Hello, everyone. I'd like to welcome you to this month's webinar. Our topic is Living with COPD, and our presenter is Robin Glock, and she is an RN and a health coach with Strategic Health Services. Robin?
Hi, good morning, everybody. Thank you for joining in. I will be presenting the Living with COPD webinar, and as Dawn mentioned, I am one of the health coaches and a registered nurse. So basically, the webinar is going to talk a little bit about what COPD is, and then we'll educate a little bit on some of the signs and symptoms and causes behind the disease, as well as how to diagnose and treat COPD. And then a good portion will be spent on educating on reducing the harmful allergens that are in your environment, as well as knowing the importance of air quality basics and discussing the air quality index. So what is COPD? COPD stands for chronic obstructive pulmonary disease, and it's a term that's used to describe a progressive lung disease. So that means that it starts out slow and gets worse over time. The disease itself is characterized by an increase in shortness of breath, and it does cover two main conditions, which is emphysema and chronic bronchitis. So the picture here gives a good idea behind, what's happening in the lungs with chronic bronchitis and with emphysema. So with emphysema, the walls between many of the air sacs are damaged, and as a result of that damage, they lose their shape. They become kind of floppy, and it destroys the walls of those air sacs, leading to fewer and larger sacs instead of many tiny ones that are what you would normally see. And then when this happens, the amount of gas exchange in the lungs is reduced. With chronic bronchitis, the lining of the airways is constantly irritated and inflamed, and this causes that lining to thicken. So that can also be with a lot of extra mucus that's forming in the airways, making it difficult to breathe and for proper gas exchange. So what are the symptoms? There's no such thing as an average case of COPD. One person's experience can be dramatically different than what you would find with another person. The most important ones, the ones that are most relevant are the shortness of breath. It's the biggest one that you'll find. Most people will start to experience shortness of breath, and then they'll find that they're unable to do their normal activities. There'll be some tightness in the chest when you're trying to take a deep breath, not feeling as though you can actually expand and get that full breath. Wheezing, which can be frequent or chronic in nature. Also a frequent cough, and that is with and without mucus production. And then chronic fatigue. Most people don't seek medical attention until the shortness of breath becomes worse and they're unable to do some of their normal activities. But it's important to remember that if we can get people educated on the topic and do better to get them to the doctor early, then we can start to treat the symptoms and the progression of the disease. So some causes of COPD, many and actually most cases of COPD are caused from inhaling pollutants, and that includes smoking, whether it's cigarettes, pipes, cigars, and also secondhand smoke. It most often occurs in people 40 years of age and older who have a history of smoking, and they can be current smokers or they can even be former smokers. And not everybody who smokes gets COPD. Most individuals who do have it, about 90% of them from what I was able to research, they have smoked in the past or are currently smoking. Fumes, chemicals, and dust found in many work environments are also contributing factors for many people who develop COPD. COPD and other lung diseases can be due to the dust and chemicals at their jobs. So coal miners, cotton fiber workers, tunnel workers, concrete manufacturers, and even some non-mining industrial workers. In these occupations, there's some tasks in certain settings where they may be inhaling the fibers or dust, which leads to chronic lung irritation and damage. And one that you may be more familiar with would be asbestos workers. And then genetics also plays a role in an individual's development of the condition. So even if you've not smoked before or don't have that work history of being exposed to strong lung irritants in the workplace, we've been able to narrow down through research that there is a alpha-1 antitrypsin deficiency, and it is a genetic risk factor for determining and getting emphysema. So this AATD is a deficiency in the protein in the bloodstream. And so without that protein, what they're finding is the white blood cells begin to harm the lungs and cause the lung to deteriorate. So the World Health Organization and the American Thoracic Society, they're recommending everybody that's diagnosed with COPD be tested for this alpha-1 protein deficiency, because what they're finding is not everybody has the deficiency. So you're going into a population of people that have COPD that don't have a history of smoking, a work environment with inhaled chemicals, and the genetic marker. So they're looking at what are some other research that can be done to find other genetic predispositions to developing COPD. So first, we need to talk about what's happening in the lungs. And so to understand the condition, it's imperative that we kind of talk about how the lungs work. So the air that you breathe is coming in, it's going down your windpipe into tubes into the lungs called bronchial tubes or airways. So in the lungs, your bronchial tubes branch into thousands of smaller, tiny little tubes called bronchioles. And then at the end of those tubes are a bunch of tiny round air sacs called alveoli. So small blood vessels that run through the walls of the air sacs. When the air reaches the air sacs, oxygen is passed through the walls in the capillaries, and then at the same time, the carbon dioxide, the waste product, is moving out of the capillaries into the air sacs. So this is like a normal gas exchange. So the airways in the air sacs, they're normally elastic and stretchy. So when you breathe in, it fills up like a small balloon, like you would fill an air balloon. And then when you breathe out, the sacs deflate and the air goes out, and so does the waste, which is the carbon dioxide. So in COPD, less air flows in and out of the airways because either the airways or the air sacs have started to lose that elastic quality, that stretchy quality. The walls between many of those air sacs become destroyed. They become thick and inflamed, and you make more mucus. And so you're having an area there where you run the risk of them becoming more clogged related to that mucus. So with this slide, it's just a nice picture that I had found that shows what normal lungs look like and what lungs with COPD. So in the picture A, you can see all of the alveoli, the little air sacs are like little grapes, and they look real healthy. And then in the lungs with COPD, you can see the bronchioles have lost their shape, and they've become clogged with mucus, and they're just abnormally shaped, and there's fewer of them available for proper gas exchange. So the outlook, how many people are affected? So COPD, it is a major cause of disability, and it does affect over 24 million Americans, and is the third leading cause of death according to the American Lung Association. So currently there's millions of people that have the diagnosis and are living with COPD across the United States, but there's also many more that have not yet been diagnosed. And that's because it develops slowly. And symptoms often worsen over time and can limit your ability to do your daily activities. And so with that, a lot of people are not yet diagnosed. Severe COPD can even prevent you from doing basic activities like walking, cooking, dressing, undressing. And most times it is diagnosed in middle age or older adults. It is not passed from person to person, so you cannot catch it from somebody else. And it also does not have a cure yet, and doctors don't know how to reverse the damage to the airways. But treatments and lifestyle changes can help you feel better, stay more active, and slow the progress of the disease. So should I get tested? I think if you have risk factors, if you have a history of smoking, long-term exposure to air pollutants, whether that's secondhand smoke or regular air pollution, if you have a chronic cough with or without mucus that you just can't seem to get rid of, you're frequently wheezing, shortness of breath that you find is getting worse over time and is not something that is going away, and you just basically can't keep up with people your own age, it's a good idea to talk to your doctor and figure out if those symptoms mean that you have COPD. So how do we diagnose it? So first thing, like we just talked about, is getting with your doctor. He's going to want to know what symptoms you're having, what's new for you, what are some of the things that you're experiencing that are out of the ordinary. And then a medical history is important. Are you a current smoker, a former smoker? Did you have contact with secondhand smoke? Are you involved in a job that you're related to air pollution or exposed to chemicals and fumes? That medical history is important, as well as a family history. Do you have a history of other lung problems other than COPD? Are there other things that they could be looking at that you have a family history of in relation to your lungs? And then some lung function tests to measure how much air you can breathe in and out and how fast you can breathe that air and how well the lungs are delivering oxygen to the blood. The main test for COPD is spirometry, and it's a painless test. A technician will ask you to take a deep breath in. You'll blow as hard as you can into a tube that's connected to the small machine, which is the spirometer. And then that machine measures how much air you breathe out. It also measures how fast you can blow the air out of your lungs. And then during that test, they may ask you to inhale some medicine that opens up your airways. And then they'll say, let's repeat that. Let's blow into that tube again, and let's compare those results and see if getting that medicine that bronchodilated, that opens you up, helps affect those numbers in the force behind which the air is expired. So that's a very good test to have, and it is also a test that's important because it can detect COPD before the symptoms develop. Some other things that they may ask you to do at your doctor's office is get a chest x-ray, get a CAT scan of your chest, and also a blood gas. An arterial blood gas, or ABGs, help determine if your oxygen level in your blood is low and if you would need oxygen therapy. So goals of treatment, because there's no cure, is basically lifestyle changes, things that help you feel better, stay more active, and slow the progress of the disease. So looking at ways to relieve your symptoms, slow the progression of the disease by taking medications and doing things as prescribed by your doctor, improving your exercise tolerance, knowing what you can and can't do in regards to exercise, and preventing and treating complications. And the basic goal there is to just improve your overall health. Are you eating a balanced diet, sleeping well, keeping active, keeping up with your preventative measures, which we'll talk about in a little bit more detail. And then your family doctor may also advise you to see a pulmonologist, and that is a doctor who specializes in treating lung disorders. So now we'll talk a little bit about lifestyle changes, and the biggest one is to quit smoking. It's the most important step that you can take to treat COPD if you are currently smoking. Talk with your doctor about programs, medications, anything that you can get in place to help you quit. If you're having trouble quitting on your own, consider joining a support group. Many hospitals, workplaces, communities offer groups and classes for people that want to quit smoking. Talk to your family and your friends. Get that hands-on support in that friend group and with your family to help provide extra support for quitting. And then try to avoid places and people and that where you would get secondhand smoke. Also look at avoiding places that are dusty or full of fumes, other toxic chemicals or substances that you can inhale. And that may be little things that you're not thinking about, like at the hair salon with the perm solution, at the nail salon, even at restaurants and bars where there are some places still that people are able to smoke. If you have COPD, it's important that you eat a balanced diet. You can have trouble eating just because your symptoms, you're short of breath, you're fatigued, and a lot of times your appetite isn't what it used to be. And so because of that, you're not getting all the calories and nutrients that you need. And that can worsen your symptoms because you're raising your risk for infection when you're not eating balanced. So talk about these changes with your doctor. Try to follow an eating plan that meets those nutritional needs. You may want to eat smaller meals, more frequent meals that are smaller, rest before eating, talk to your doctor about maybe taking vitamins or nutritional supplements, or even meeting with a dietitian. And then exercise. Talk about what are some safe and approved exercises for you to do. It may be a little bit more difficult. You may find that activity is a little bit more challenging with some of the symptoms, but physical activity can strengthen the muscles that help you breathe and just improve your overall wellness. So it's important to keep that in mind, that being active is an important aspect of this disease process. Now we'll talk a little bit about treatment and taking your medications as prescribed. Bronchodilators are used to relax the muscles around the airways. So it helps open up those airways, makes breathing easier. And depending on how severe your COPD is, your doctor may say, okay, let's do a short-acting inhaler, which lasts about 4 to 6 hours, and also a long-acting bronchodilator that lasts up to 12 hours and can be used once or twice a day. Another thing that they'll do if you have more severe COPD or if your symptoms are flaring up pretty often, they may prescribe a combination of medications, which is the bronchodilator that we just talked about, along with some inhaled steroids. And those steroids that you inhale help reduce airway inflammation and can help make breathing a lot easier. Vaccinations. They're preventative for people with COPD, so your doctor may ask you to get the flu shot. Influenza can cause serious problems for people who have COPD, and getting the flu shot once a year can reduce your risk of getting the flu. So that's one thing that your doctor may recommend, as well as the pneumonia vaccine. It lowers your risk for pneumococcal pneumonia and the complications. People who have COPD are at a higher risk for pneumonia than people who don't. So talk about the importance of getting that vaccination as well. Oxygen therapy. If you have severe COPD, they've determined that you've got low levels of oxygen in your blood. Having oxygen therapy can help you breathe better. Some people are prescribed to wear oxygen all the time. A lot of times they're just doing it at night, or they're using it if they're doing and exerting themselves, doing activities such as cooking, cleaning, walking around, getting some things done around the house, anything that's exertional, and that would be something that would be determined when you should use it with your doctor. And then lastly would be pulmonary rehab. And it's a really great program. It helps improve the well-being of people who have chronic, ongoing breathing problems. It includes an exercise program, disease management training, some nutritional and psychological counseling. And the goal is to help you stay active, carry out your daily activities. And that team is made up of doctors and nurses, physical therapists, respiratory therapists, exercise specialists, and dietitians. And those people will get together and create a program that meets your individual needs. So living with COPD, it's important to avoid lung irritants. So if you smoke, quitting smoking, it's the leading cause of COPD. Talk about ways, like we said, to get into programs, products that you can use to get yourself to a place where you can quit. Also avoid lung irritants that can contribute to the COPD, so secondhand smoke, air pollution, chemicals, fumes, dust in the house. If your house is going to be painted or sprayed for bugs or insects, or you're having some work done, it's a good time for you to stay away for a while from the house so you don't irritate your lungs. If possible, keep your windows closed and stay at home if you know there's a lot of air pollution or it's really dusty outside. See your doctor regularly. It's important to get ongoing medical care. Take all of your medicine as the doctor prescribes. Make sure you have refills on your prescriptions before they run out. And then try to do some things to manage your surroundings. So do activities slowly. Put some items that you need more often in one place that's easy to reach. Find some simple ways to cook and clean and do other chores. So like having like maybe a small table, something set up that has like maybe all of your medicine, things that you would need during the day. Even investing in those long-handled tongs for reaching things so you're not overexerting yourself. Bringing these things together, moving and adjusting your home to avoid you having to climb the stairs very often can be helpful to avoid having some issues with breathing. Watch what you're dressing in. Wear some loose-fitting clothing, shoes that are easy to take on and off. That is sometimes a source of where the shortness of breath can get worse. And ask for help. Ask your family and friends for help, and know that you don't have to do this alone. You can have some people help you with these different activities. And then prepare for worsening symptoms. So if you have COPD, know what your normal is, know when you should seek help for some worsening symptoms, or if you need to go to the emergency room for severe symptoms, you can't catch your breath or you can't talk because you're so short of breath. Also, if you have a fever, any signs of infection, notify your doctor, and you may need some adjustments to your treatments, to your medicines. Keep phone numbers handy for the doctor, the hospital, someone that you would use to take you to the doctors, and then always have a list of medications that you're taking. That's important as well. Now we'll talk a little bit about the air in your home. The air that you breathe has a big impact on your health, and indoor air can sometimes be more polluted than outdoor air. So according to the Asthma and Allergy Foundation of America, there's 3 major airborne threats in your home. It's allergens, irritants, and dangerous chemicals. With allergens, that comes from pollen, dust mites, pets, and that causes an immune system reaction. So if you're thinking about, the yellow pollen that you see in the spring that lays on the cars, and if you have your windows open, that lays in your house, those are things along with dander from pets and certain things that can cause that immune reaction, the immune system reaction. Then there's irritants that don't necessarily trigger your immune system, but those compounds can make breathing more difficult. So that would be paint, finishing furniture or staining furniture, any chemicals or pesticides, so again, tobacco smoke. Cleaning products can be irritating and have an odor that can cause you to have trouble breathing, as well as perfumes and even scented candles can irritate your lungs. So how do you help at home? And there's a lot of different things that you can look at. The most important thing is to keep your home smoke-free. No smoking at all, ever in your house. Remove clutter, things that collect dust can cause more irritation to your lungs. Wash your bed linens weekly. Keep your pets off your furniture. Reducing your exposure to household chemicals such as paints, varnishes, cleaning products, that's also something that you can look at. Vent wood-burning stoves or fireplaces. So if you have a wood-burning stove or a fireplace, make sure it's clean, well ventilated, it's getting all of the smoke out of your home. Have those chimneys and fireplaces checked and cleaned at least once a year. Use your ventilation system. So if you are cooking, that means using the exhaust system near the stove. If you're in the bathroom, using that fan in the bathroom to help carry that moisture and humidity out of the house. Have some fans on hand to put in windows if you occasionally need more airflow to ventilate your home, especially if it's not humid out. And also with your heating and air conditioning system, change your air filters regularly. Mark it somewhere. A lot of times the thermostats now will even tell you it's time to change it. But make sure that you're using a high quality, investing in a little bit more expensive, high quality air filter. Another good point is keeping humidity levels low, running a dehumidifier, open windows when the humidity levels are low, running ceiling fans. You want to aim for an indoor humidity level less than 50%. Mold and dust mites, they tend to grow in a humid environment, so you want to keep the humidity down, and you also want to eliminate mold. Biggest problems in basements is mold. You can see it. You can sometimes smell that musty, wet smell in your house. It's a good idea. Look through your home. Look for any cracks, leaks. Seal them up. It irritates your lungs. Ask somebody to come in, clean the area. Have a professional come in, seal up the cracks. Get that done to help keep your lungs protected. And then lastly would be switching your cleaning products. Limit harsh chemicals, scented cleaning products, anything with bleach, anything that you have to, those chemicals that you're breathing in. The rule of thumb is if you can eat it, you can clean with it. So look at baking soda, vinegar. If you're dusting and using different cloths, look at the Swiffer sweepers, the kind of things that absorb the dust and draw it in, versus brooms and vacuums that kick up the dust that you can sometimes even see just in the air in your home when you're using them. So out and about, it's important to make sure you're familiar with what's happening in your area, and you can check in usually with your local weather and news station. They'll have advisories for pollen and air quality. I know I see it a lot more in the summer, but you can still check out what your local air quality index is by going to airnow.gov. It's a government-run site that helps determine what the air quality is where you live. All you do is put in your zip code, and it breaks down the air quality condition into numbers, and then further breaks that down into the particles and ozone, which are the 2 main things that you worry about on a daily basis. It also gives you a nice little weather forecast over the next few days, and gives you an idea what the ozone level is. So if I would go in and I would type my zip code in, it would pull up today the ozone level in Pittsburgh is green. if you click on green, it takes you to the air quality index, which I'll show you on the next slide. And it tells you that green means it's a great day to be outside. And so it does give you some tips and tricks on knowing what to do. Another thing about your air quality is when you're working, what's in your workspace? Are there people there wearing perfume that's causing you some irritation to your lungs? Is there a way to talk to them or human resources about, getting that taken care of? Can you avoid, areas that are dusty, or at least keep your workspace clean? As the disease progresses, do you need to change your hours, work less hours, or change the type of things you're doing because you can't do the heavy lifting and you're sometimes your job uh, duties need to change as the disease progresses. This is the air quality basics that I was just talking about. It's the index for reporting daily air quality. It tells you how clean or polluted the air is and what associated health effects might be a concern for you. The air quality focus on what's happening within a few hours or days that you've been out breathing in the air. So the EPA has 5 major air pollutants that are regulated by the Clean Air Act, but the basic 2 that we worry about are the particles and the ozone. So the purpose of it is to understand what that air quality means to your health, and it's also to show you what the health concerns are, and it breaks it down nicely. I like the colors, and it kind of gives you an idea of how it goes from a yardstick measurement of sort of 0 to 500, and those health warnings that go along. So when you're looking at the orange section there, which is unhealthy for sensitive groups, that's something that we're going to want to look at as a group if you have some COPD and some lung issues. So air advisory orange, that's for unhealthy for sensitive groups, and it's not usually a general public concern, and most people in the general public aren't going to be affected at that range. People with lung disease are at a greater risk from the orange color just because of the exposure to ozone and particles in the air. So your chances of being affected increase more with strenuous activity and the longer that you're outdoors. So some things to think about are get out early in the day, run your errands as early as possible. Avoid overexertion. So if you do want to exercise outside, stay away from busy highways where the pollution is worse. Also, go out earlier in the day. And you may find that, you may want to do some activities indoors that day instead of going outside. So that's why just knowing what your air quality index number is for the day is important, especially if you have activities planned and you don't want to make your symptoms worse. This concludes the webinar on living with COPD, and I'm happy that everybody was able to join this morning, and always like to remind you that you do have a health coach. Feel free to reach out by secure message or giving us a call. We are here to help support you with your health goals, and I hope you have a great day. Thanks for joining.